Dr. Ken Landau. Thanks for watching. Let's talk about spironolactone. Now, the brand name is aldactone, but it's not generally used. It's spironolactone that everyone knows it by. It's a potassium-sparing diuretic. It was approved by the Food and Drug Administration in 1960, and it still ranks among the 75 most prescribed drugs in the United States, with more than 12 million prescriptions written annually, even though the medicine happens to be more than 60 years old. It's on the World Health Organization list of essential medicines. The primary use of the drug is for retention of fluid. That's what we call edema. And it's due to heart failure or liver cirrhosis or kidney disease. That's when fluid restriction and sodium restriction don't work and the other medicines don't work. You develop a condition known as secondary hyperaldosteronism. That's a hormone that your adrenal glands produce. And when your adrenal glands produce this hormone, it tends to retain the sodium and water and push out the potassium. Well, the spironolactone does just the opposite. So that's a good thing. So we use the medicine when the kidneys don't work and the liver doesn't work and the heart doesn't work as well as it should. We also use it for hypertension. It also seems that a person can develop the increase in that aldosterone level, something we call the primary hyperaldosteronism, if you happen to have a tumor of the adrenal or just what we call hyperplasia of the adrenal gland, overactive adrenal glands. And sometimes when they do that, we use this medicine either for a short term before surgery or for a long-term maintenance in people who for one reason or another are not susceptible or not candidates for surgery. Off-label, it's used a lot. It's used for people who have low potassium level that doesn't increase when they take supplements. It's also used for a condition, a genetic condition of the kidney known as Bartter Syndrome. That's relatively unusual, but it's associated with a low level of potassium. And interestingly, this drug that we all think of as a potassium-sparing diuretic is also used for excessive hair growth in women, and it's used to slow down early puberty in boys and in people who transgender or switch sexes from male to female. It also is used as an anti-androgen. And interestingly, somehow it was found that it might help people who have sarcoidosis. Now, off-label, it's very frequently used to treat women who have the polycystic ovary syndrome or polycystic ovarian disease. It's used for treating acne, but just in women, for people who have excessive oiliness of the skin, women who have hirsutism. Actually, it's the most common treatment for hirsutism in the United States, and it's used to treat women who have the male patterned hair loss. So women 30, 40, 50 years of age who start losing their hair diffusely. And due to the anti-androgen effectiveness of the drug, it's not really used for men except for a short period of time, especially in those individuals who have decompensated heart failure. Well, it can also potentially block the replication of the Epstein-Barr virus, and it might be effective in some people with either rosacea or fibromyalgia. Now, there's a related drug called Inspira, and that lacks the anti-androgenic effect, so it might be okay for men in the long term, but unfortunately it's not as effective in reducing the death rate in people who have heart failure. Now, the spironolactone is a derivative of progesterone. Progesterone, of course, is a female hormone, and it's due to structural modification of the progesterone. And that alteration of the progesterone led to the anti-androgenic effects. So it's a potent anti-mineralocorticoid, which means it fights against the aldosterone. And the aldosterone, again, is the hormone that causes the body to get rid of potassium and to increase the amount of sodium and water in the body, exactly what we don't want. So let's take a look at it. The primary use is in heart failure. Now, we have different kinds of heart failure. The heart failure is something you want to avoid. That's why you treat your blood pressure when you're relatively young. You go and watch your cholesterol. You do all those other things so that you don't have some damage to the heart as you grow older. Heart failure is when the heart doesn't provide enough oxygenated blood to the rest of the tissues. It can come in two varieties. It can come with reduced ejection fraction, So normally when the heart contracts, it pushes out more than 50% of the blood that happens to be in the chambers. But in heart failure, very frequently, it's going to pump out less than 35 or 40%. Well, it was said that the drug is very useful in those individuals with reduced ejection fraction, but not in the people who had the normal ejection fraction. And the reason it was thought not to work in people with normal ejection fraction is because of one of these multinational studies that was done in part in Russia. And in Russia, people weren't taking their medicine, so it gave us what we think are false indications that the drug is not useful in people who have normal ejection fraction with heart failure. The bottom line of the story is, if you have heart failure, no matter what your ejection fraction is, probably this is a good drug. And it's important that we have good drugs because the death rate from heart failure has increased by about 40% just between 2011 and 2017. Now, spironolactone is not a treatment by itself, but it's an add-on treatment to diuretics and ACE inhibitors and maybe beta blockers, and in the old days we used digoxin very frequently. Well, if you add the spironolactone, it can actually decrease the mortality and the morbidity in people who have moderate to severe heart failure, decreases the symptoms of heart failure, decreases the likelihood of hospitalization, decreases the death rate by about 30% compared to just giving a placebo therapy. And the best results occur in those people who have low potassium to begin with. Now, the action seems to have something to do with the aldosterone. And the aldosterone concentration in heart failure is about 20-fold greater than normal. And that aldosterone is going to regulate the hemodynamics, the blood flow to the different tissues, and the remodeling of the heart. The heart's constantly being remodeled, but unfortunately in heart failure, it's remodeled in a bad fashion. Well, it also works on the ability of the body to get rid of salt. So the effect in heart failure seems to be more in the remodeling effect than it is in getting rid of the salt. So we have to consider alternatives to the spironolactone if the person's kidneys don't work well. So the kidneys don't work well, we know that on a blood test. We measure the creatinine. So in men, if the creatinine is more than 2.5, and women, if it's more than 2, we have a potential problem. And if the what we call glomerular filtration rate, the amount of the blood that's cleared every minute by the kidney, if it's less than 30 milliliters per minute, then we have a potential problem. And so too, if the potassium already is high. So let's look at the 2-year mortality rate in people who are taking the regular therapy plus spironolactone versus just the regular therapy alone. Well, we find the all-cause mortality falls to about 35% if you take the spironolactone, but it's almost 50% if you don't. And if we look just at the cardiovascular mortality, it's about 25% with spironolactone versus about 35% without the spironolactone. And we find that there's improvement in the New York Heart classification. So you go from grade stage 3 or 4 to a lower stage, about 40% of the people versus 30% of the people who are taking the regular medicines, but not the spironolactone. Unfortunately, even if you take spironolactone, you could get worse, and about 35 to 40% of the people over a 2-year time period with heart failure are going to get worse, even though they're taking the spironolactone, versus about 50% if they're not. So the bottom line is avoidance, avoidance, avoidance. Do those things when you're relatively young, when you're 20 and 30 and 40, so that you don't have heart failure when you're 50, 60, and 70. Now, if we talk about the hirsutism, excessive growth of hair, the terminal hair, not the fine vellus, the depigmented hair, but we're talking about the thick, dark hair, spironolactone seems to work relatively well. There's a delay period of about 6 months, and while you're taking the medicine, for those women who are taking medicine, of course, it can lead to menstrual irregularities, but that can be corrected by taking a birth control. And anyone who can potentially get pregnant while they're taking spironolactone should be on a birth control method. Other anti-androgenic therapies right now, Proscar, it's a medicine we use for an enlarged prostate, or finasteride, again with the birth control pill, or there's flutamide or Ulixin that can be used, but it has a lot of side effects, so Casodex might be a little bit better, but the prime anti-androgen happens to be spironolactone, which means since it's an anti-androgen, it's very good in treating acne, either by itself or in combination with the birth control pill. Seems to work relatively well, even as a first-line therapy for acne instead of taking an antibiotic. It has a dose-dependent effect, and unfortunately, again, it can take several months to become effective, but it can reduce acne by anywhere between 50 and 100% in women who seem to have hormonally reduced flares of acne. But again, remember, it causes menstrual irregularities, and women who are taking spironolactone, if they can become pregnant, should be on some method of contraception. About 1 in 100 individuals who has high blood pressure has the high blood pressure because of an increased concentration of that aldosterone in the system. So in most cases of hypertension, it seems that a low dose of spironolactone doesn't really add anything significant. At a higher dose, it tends to be associated with side effects. But it certainly can be used as an add-on medicine to prevent the loss of potassium. Now, in transgender women, it seems to be a routine component of the feminizing hormone therapy, in combination, of course, with estrogen, in areas of the world where cyproterone acetate is unavailable. It's unavailable in the United States. Well, it decreases, the spironolactone decreases the male pattern hair loss, it increases breast development, it causes feminization, and it causes a lack of spontaneous erections, which you would think would be something that the transgender women would like. However, now some of those women are complaining that that's an unwanted side effect. Well, the tablets are available in 25, 50, and 100 milligram, and they're also available as a suspension, 25 milligrams per teaspoon. In Italy, for a short time in the 1990s through 2006, it was available as a topical therapy, either 2% or 5%, but the Ministry of Health in 2006 declared it inappropriate to use the medicine because it could be used in doping. Well, the initial dose, if you're treating heart failure, is just taking 25 milligrams a day, treating edema, swelling, the fluid retention, 100 milligrams a day, either as a single dose or a divided dose, could go anywhere from 200 to 25 milligrams. Hypertension, usually somewhere between 25 and 100 milligrams. There's no benefit in using a higher dose for hypertension. The more you take doesn't seem to give you any extra benefit. And if you have one of those problems with the adrenal gland where it's making too much of the aldosterone, then you could take anywhere between 100 and 400 milligrams. The maintenance dose, if you have essential hypertension, anywhere between the 25 and the 100 milligrams a day, 1 or 2 doses. If you have the ascites, 100 milligram to 400 milligrams, same dose if you're a transgender woman. And if you have acne or excessive hair growth, the dose is 100 to 200 milligrams a dose for maintenance. Now, you can take it either with food or without food, but it's important that you take it consistently, either with food or without food, for a reason that we'll talk about in a minute. Now, in heart failure, it seems that we potentially have a problem. It's good if your potassium is less than 5 and your glomerular filtration rate is more than 50. In other words, your kidneys work pretty well. Then you start 25 milligrams a day, then you go to 50 milligrams as necessary. However, if your potassium is a little bit high, say over 5 milligrams, then you have to start at a lower dose, 25 milligrams every other day. And the same thing, if the kidneys don't work really well, but they still work, 25 milligrams every other day is an okay therapy. Now, it's a weak diuretic by itself, and it targets an area of the kidney after most of the action has taken place. So it's sort of the last area of the kidney where sodium metabolism can be altered. Once you take the medicine, it doesn't seem to work as a diuretic for at least 2 or 3 days after you start taking the medicine, and it doesn't reach its maximum level till about 2 to 3 weeks after the beginning of therapy. But it seems to be quite effective when it's added to other diuretics. And unlike most of the diuretics that cause you to lose the potassium, that's why you have to take some potassium supplements sometime, with spironolactone, you don't take any potassium supplements. Now, the drug is a prodrug. the spironolactone isn't really effective by itself. It has to be metabolized, and it's very rapidly metabolized in the body to the metabolites. The metabolites are the active ingredients. So spironolactone has a high level of anti-mineralocorticoid activity. It has a moderate anti-androgenic activity, and it has a weak activity to prevent the body from making other steroids. So the mechanism of action. Well, it blocks the effect of other hormones like aldosterone and testosterone. It counteracts the hyperaldosteronism that's associated with the heart failure and the cirrhosis and the problem with your kidneys. Well, it also seems that the drug can work on the hyperaldosteronism that's caused by taking a diuretic. When you take a diuretic, you lose fluid, and when you lose fluid, your volume, your blood volume is relatively contracted, and as a result, your body starts to make the aldosterone, which tends to negate the effect of the diuretic you took in the first place. So that's why spironolactone is now being frequently added to other diuretics. And again, remember, it works in a different area of the kidney than the other diuretics. And so it blocks the mineralocorticoid, so it blocks the receptors for aldosterone. It doesn't stop the aldosterone from being made. And its action on the aldosterone is how it works in the edema and the ascites and the cirrhosis and the hypertension and the heart failure and the hyperaldosteronism. But the body tends to produce more of the aldosterone as a mechanism because it thinks the body isn't doing what it's supposed to do, so it needs more aldosterone. But the effect is blocked by taking the diuretic. Well, the anti-mineralocorticoid effects also are responsible for some of the side effects like urinary frequency and dehydration and low levels of sodium in the body and low blood pressure and sometimes fatigue or dizziness or metabolic acidosis or elevated potassium, or even an effect to decrease the renal function. But those, fortunately, are relatively rare, except for the renal function and the potassium. Well, it works as an anti-androgen, so it blocks the effects of the androgens on the target. Again, it doesn't stop the androgens from being made, but it stops the effect of testosterone and dihydrotestosterone. It might lower the production of testosterone a smidge, but that's not a major effect. And by doing all of this, it in effect disinhibits the estrogen from working. And that's important. So you take the medicine, it stops the male hormone from working, but there still is a lot of female hormone floating around, and the male hormone level might be slightly increased and can be metabolized. So the anti-androgenic effects of the medicine, well, primarily used in women, of course, to reduce acne and for hirsutism and for the male pattern baldness that occurs in women and the oiliness of the skin that some women complain about. And sometimes women just have an excess amount of male hormone. Spironolactone is relatively good for that. But remember, since it blocks the effect of male hormone, and some of the male hormone can be converted into the female hormone, so we can get some more female hormone, or the activity is what we call disinhibited, so that means that there can be some breast tenderness and enlargement of the breast and feminization, and certainly in men, the reason it's not very frequently used is because it causes demasculinization. Well, it also is a weak steroid inhibitor, so it can prevent the production of certain kind of hormones, and that can lead to some of the menstrual irregularities. And remember, it can increase the level of estradiol, the female hormone, not so much because it increases the production of estrogen from the standard areas, but it's taking the male hormone that's floating around and it's converting it to the estradiol, which is relatively good for some women because it can increase the bone mineral density. In other words, it can treat or help prevent osteoporosis, but it also tends to cause some breast enlargement and some breast tenderness, something we call gynecomastia. It also has a weak effect on the estrogen and the progesterone receptors. What are the side effects of the medicine? Side effects of the medicine are not very significant, other than it can increase the potassium. And it increases potassium in concert with the dose. So the higher the dose, the higher the potassium. Can cause a low level of sodium, low level of magnesium, low level of calcium. It can also cause a mild decrease in the blood pressure, cause some nausea or vomiting or headache, can cause a rash in rare instances, lead to urinary frequency and dehydration, can increase the blood sugar, and can precipitate gout in those people who are so predisposed, might lead to some difficulty with muscle incoordination and some ataxia or drowsiness or dizziness. Sometimes that's due to the change in the sodium and the magnesium and the calcium. Decrease the desire for sex. Remember, it's an anti-androgen, anti-male hormone medicine. So who does it lead to an elevated potassium in? Well, principally in elderly individuals and people who have some kind of kidney problem, and in people who are taking other medicines like the ACE inhibitors, lisinopril, or the angiotensin receptor blockers, medicines like valsartan. It can also increase the potassium in people who are taking the non-steroidal anti-inflammatory drugs like ibuprofen or naproxen. People who are taking potassium supplements or salt substitutes. Salt substitutes are basically just potassium chloride. So you have to monitor the person's blood potassium and the kidney function, especially if they develop nausea or fatigue or muscle weakness. Now, menstrual irregularities, in women who are taking moderate doses, probably somewhere between 10 and 50% are going to develop the menstrual irregularities. 100% of women at higher dose, they're going to have heavier bleeding, going to have bleeding in between the periods, irregular bleeding. But those abnormalities, fortunately, are well controlled if women take the birth control pill. Now, it's important to realize that spironolactone has no contraceptive value itself. You need to take an additional method of contraception. In men, side effects are increase in the breast size, increased breast tenderness, feminization, decreased libido, erectile dysfunction, can cause a decrease in fertility. Fortunately, it's reversible, but at a high dose, it can cause testicular atrophy. So in men, enlargement of the breast occurs in about 30%, at 1 in 3, at a dose of 100 milligrams. Higher dose, 200 milligrams, going to cause breast enlargement in about 2/3 of men. It's relatively mild. Women, breast tenderness is going to be about 40% of women at a moderate dose. Enlargement of the breast, about 25%. If a person's taking a low dose, the time to develop those changes in the breast is going to be about 2 years. At a high dose, it's going to be about 9 months, mostly resolved when a person discontinues the medicine, but it takes several months for that to happen. And because of those changes in the magnesium and the calcium, you might get some leg cramps, might be associated with a low level of white blood cells in the system, have to be monitored every once in a while. Pregnancy, the medicine is not for women who are going to become pregnant. Women who take the medicine, take the spironolactone, if they can become pregnant, should take some method of contraception. Well, high blood pressure in pregnancy is bad. It can lead to preeclampsia and gestational diabetes and lead to premature delivery. But cirrhosis in pregnancy, if it's untreated, certainly has a poor outcome. Even if it's treated, can have a poor outcome. It can develop hepatic failure or bleeding from dilated blood vessels at the junction of the esophagus and the stomach, something we call variceal hemorrhage. It can lead to fetal growth retardation. But if you take the spironolactone, and you happen to have a male fetus, it can cause feminization of the fetus 5 times more than expected. Now, there's no abnormality with some of the other medicines that are available for use in women who are pregnant. But it's very important to realize that this is a drug that probably shouldn't be taken in pregnancy, and even if it's necessary and it is given, well, it can lead to a condition known as Bartter Syndrome. And Bartter Syndrome is where you can have kidney abnormalities, and it's associated with alteration of the potassium and muscle weakness and cramping and fatigue. And in animal studies, shows there are reproductive tract abnormalities that do develop. So remember, not appropriate for pregnancy. And by the same token, probably not appropriate for women who are breastfeeding, even though only a small amount, maybe about 0.5% of the mother's blood concentration is going to get into the fetus, into the breast milk, rather. So inappropriate. Overdose, you got to have something wrong to overdose on a diuretic. If you do overdose on the diuretic, The side effects are going to be you're nauseated and you vomit and you have diarrhea, you might get a rash, you might feel dizzy and drowsy and confused. Your sodium will go down and your potassium will go up, and you'll wake up and you'll say, what the heck did I do? Well, the lethal dose, 50% lethal dose, is over 1,000 milligrams per kilogram in mice and rats and rabbits. There's no antidote necessary for the overwhelming majority of people, other than support, make sure they have enough fluid, give them electrolytes, take care of the vital function. And if the person recently overdosed, then we either induce vomiting or pump the stomach. The bioavailability, once you take the medicine, anywhere between 60 and 90% gets into the system. Now, here's where the food part comes into play. If you take it with food, you will have an increase in the blood concentration of the spironolactone anywhere between 25 and 100%. So it seems that food increases the gastric dissolution, and that leads to greater absorption, and it decreases the metabolism the first time it goes through the liver. So that's very important. That's why you either take it all of the time with food or all of the time without food. It's very important. And you'll reach a steady state effect after you've taken the medicine for anywhere between 8 and 10 days. The concentration of spironolactone, the peak concentration, is going to occur in about 2.5 hours, but of some of those metabolites that are the active ingredients, about 4 hours later. Now, if we put it on topically, not going to be absorbed significantly. About 90% of the spironolactone is going to be bound to plasma proteins, but it's not going to displace other kind of steroids from the carriers. So it's not going to increase the level of the estradiol or anything else. It's going to cross the blood-brain barrier. It's going to be metabolized in the liver rapidly and extensively. The half-life of spironolactone by itself is only going to be about an hour and a half, but the metabolites that are really responsible for the clinical effect of the medicine, the half-life of those drugs is going to be anywhere between 14 and 17 hours. That's why you really only have to take the medicine once a day and at most twice a day, but you have to be careful if you have liver impairment, because if you have liver impairment and you take the medicine, it might precipitate hepatic encephalopathy and coma if you happen to have the ascites and the cirrhosis and you have the fluid on board. So that's very important. And if you have kidney impairment, it could increase the potassium, and too high potassium level can lead to major problems with the heart. Now, the drug is not metabolized by the typical drug metabolizing enzymes in the liver. It's eliminated principally in the urine, a little bit in the stool. It can interact with other kind of medicines. Have to be careful because of the potassium level. If you're taking one of the ACE inhibitors, lisinopril and allopril, or the angiotensin receptor blockers, medicines like valsartan or Diovan, the nonsteroidal anti-inflammatory drugs like ibuprofen or naproxen, and trimethoprim. Trimethoprim either by itself, it's an antibiotic, or Bactrim, it's half of Bactrim. Heparin, you have to be careful. So you might need to change the dose, actually, of aspirin. You should not take potassium supplements, and you shouldn't take salt substitutes while you're taking the spironolactone. If you change the dose, you have to be cautious of the potassium level. Have to be cautious of the potassium level in the first several months of therapy anyway. You need a blood test to check and see what's happening. Maybe in older individuals, you should limit the amount of foods that are rich in potassium. That's one of those iffy things, but that's not important for relatively younger individuals. And as a matter of fact, for otherwise young, healthy individuals who are taking the medicine maybe to control some acne, then there's some argument that maybe we don't even have to monitor the potassium. Now, if you happen to have manic depressive disorder and you're taking lithium, that's a potential problem because the concentration of lithium is going to increase. So you have to be very careful about that, and appropriate monitoring is necessary. Now, while the spironolactone itself doesn't seem to do much to the drug metabolizing enzyme, some of the metabolites do, and as a result, you have to be careful taking other blood pressure medicines and heart medicines. And interestingly, licorice has an indirect mineralocorticoid effect. So it inhibits the effect of spironolactone. Now, I'm not talking about the licorice that you get at the routine grocery store. That's just sugar. That's confectionery stuff. But we're talking about real licorice. Licorice can make you have a low potassium level. Well, if you happen to be taking spironolactone and you're bothered by some of the anti-mineralocorticoid effects, then it might be, especially for women who are taking it for certain of the anti-androgenic effects, then it might be that licorice could help out with some of the side effects, including some of the breast tenderness that might develop. Well, as a drug interaction, it seems that it helps the non-steroidal anti-inflammatory drugs, changes the way they work a little bit, so have to be a little bit careful. Same thing, have to be a little bit careful taking aspirin. Those two drugs need caution because they're going to attenuate or decrease the diuretic effect. They're going to decrease the ability to lose the sodium, but they're not going to change the blood pressure lowering effects, apparently. There's some evidence that spironolactone might interfere with the actions of antidepressants, so caution is necessary. The drug has an interesting history. The natriuretic effect, the sodium lowering effect of progesterone, the parent compound, was first noted in 1955, and as a result they started playing around with changing the structure, and they developed spironolactone as a synthetic anti-mineralocorticoid in 1957. Just 2 years later they patented in 58, first marketed in 1959. Then they reported cases of gynecomastia, enlargement of the breast, in 1962, the anti-androgenic effects in 1969, and therapy for hyperandrogenism or hirsutism in women in 1978. And again, it's the most widely used anti-androgenic in the world. So what is the cost? Good news for you on the cost of the drug. You can get the generic drug, 25 milligrams, 30 tablets. You can pay cash for it, and it's only $12 to $18, except at Walgreens, where it's $23, or with a coupon from GoodRx, it would only be $6 to $12. If you happen to want the aldactone by itself, the parent compound, the brand name, you could buy that with a coupon for anywhere between $90 and $110. So basically, there you have it, spironolactone. It's very helpful for fluid buildup from heart failure and kidney disease and liver disease, where its effects can be life-saving, actually, especially in heart failure. And the same drug is useful for controlling acne and treating hair loss in women caused by excessive male hormone. But remember, since it tends to cause the potassium level to go up, you don't want to take any potassium supplements with it, and you have to be extra careful if you happen to have some altered kidney function. So anyway, thanks for watching. If you enjoyed the show, please tell a friend and consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.